I'm Deborah Proctor, and I'm the President and CEO of St. Joseph Health. St. Joseph Health is really excited because this year we're celebrating our 100th Jubilee of the Sisters of St. Joseph of Orange. That's the group of women who founded St. Joseph Health. I've been the CEO for the last 7 years, and it's kind of a coming home for me. I actually started very early in my career at St. Joseph Hospital in Orange as a nurse. I had spent some time in LA as a nurse first, and then came to the St. Joseph Hospital in 1976 and worked there and at the system office for the next 14 years. I left the system in 1990, and then I went in to work for several other firms in a broader-based healthcare practice, did consulting around the country in healthcare. Came back to Catholic Healthcare in 1999, working for Ascension Health, the largest Catholic healthcare system in the country, and then I came back to St. Joe's as the CEO in 2004. You know, I think there are many things on the horizon that are very exciting in healthcare. It's interesting to me, most people talk about healthcare reform, and they talk about it in a negative sense, and they are unhappy about healthcare reform or concerned about healthcare reform, and I actually see that as one of the most exciting developments in a long time. Whether you agree with everything in the bill or not, healthcare reform is asking us to do the things we should have been doing as a healthcare system for many years. Another thing that's exciting about it is that this is a time when we're starting to focus on the right thing, which is health, and not just focus on illness. In this country, we've tended to treat people when they got sick as versus try and keep them from getting ill. And this is something we embraced several years ago. We decided to transform ourselves into an organization that was focused on health as well as illness. That's why we've recently changed our name to St. Joseph Health. You know, there are a lot of challenges on the future. One of the biggest challenges facing us, I think, will be a workforce shortage. It's anticipated that we will have about 50% of the supply of physicians that will be needed in this country. That's going to be an area of much concern. We have a lot of people retiring from the baby boomer years, which is causing some of the skill shortage. A lot of folks will be retiring out of our nursing ranks and our other specialty ranks like pharmacy and rehab and laboratory and physical therapy. Those positions can be very hard to recruit to at this point in time. You know, I'm really proud of a lot of the things that we're doing at St. Joseph Health. One of those things would be we introduced a program called Spotlighting, and we borrowed a technology from other industries where you take a look at a very specific moment of a patient experience. And it's a moment where we think the patient is very vulnerable or where their experience could go wrong. And we study it very carefully. We talk to staff about it, involve staff in it. And people are very clear about what they could do to make a particular vulnerable moment a better moment for people. So for instance, it's very hard to go to sleep at night in a hospital. So one of our hospitals created a program they call Sweet Dreams, and they put together a way in which they help someone go to sleep at night by what they bring them, how they serve them, how they treat them at that time, where rest is so important. We have another experience around, you know, the arrival of a new baby, another experience around leaving the hospital with a new baby. So that's a very creative experience that we put together. But probably what I'm most proud of is that we established a goal for ourselves about 7 years ago called Perfect Care. And that's really our goal, is that every single person who comes into our organization would receive perfect care, meaning the right care, you know, at the right time and in the right way.